Hello, I'm Nurse Cam from Heyday Clinic, joined today by Dr. Jim, also from Heyday Clinic, and today we're going to be speaking about who can prescribe medicinal cannabis in Australia. So, Jim, take it away.
Hi, Cam. Well, medicinal cannabis is a medicinal product, so used for treatment of symptoms or diseases that's derived from the cannabis plant. And these are usually products that contain things like CBD or THC, sometimes other minor cannabinoids like CBG, but also including terpenes and flavonoids and other elements as well will go into these products. So they're actually medicinal products. They have a pharmacological effect within the body for certain conditions.
And who can prescribe these products?
So in Australia, any doctor is able to prescribe medical cannabis products. So a lot of people out there think that you need to be specialized in this area or have done special training programs or pathways to be able to prescribe. But no, you just need to understand the processes in regards to applying. But predominantly, I see most prescribing done out of general practice. There are specialized cannabis clinics as well that do have increased knowledge in regards to how to apply these particular medicines to certain conditions. And then specialties where there is a high need for or high value, I guess, for medical cannabis within their patient population. So things like psychiatry, palliative care, oncology, pain medicine as well. But it might also include things like rheumatology and neurology. At this stage, though, in those sort of certain areas, the prescribers are limited, and we see most prescribing done in general practice. At this stage, I haven't seen too many hospital doctors prescribe medical cannabis, but there is no reason why they can't, apart from hospital policies within the system within which they're working. There's no governmental sort of reason why they can't prescribe medical cannabis as well.
Okay, so most health practitioners can prescribe medicinal cannabis, whether you're a medical doctor or a general practitioner, a specialist operating within a specific domain. A nurse practitioner, I believe, can also prescribe medicinal cannabis. Now, when it comes to state versus federal jurisdictions and requirements, are there any kind of differences there?
So the federal requirements are the same across all different states. So that's an application to the TGA, generally through the SASB portal. But each state has their own adjunctive sort of applications that may need to be done for certain populations. So some states have a limitation on the amount of THC that can be prescribed in a 24-hour period, like Western Australia. South Australia, the strength of the inhaled flower products, I think, are capped at 20%. Other states might need specialist endorsement for certain population groups, like the pediatric populations, or there might need to be specific applications done to a state to get approval for patients that might have had issues with drug and alcohol abuse and these types of things in the past. So often the extra state-based application is an extra safety precaution that particular state feels is necessary to maintain the health of its citizens.
Okay, interesting. Now, as well, when it comes to some of these, medicinal cannabis clinics, I think that it might be worth mentioning that more often than not, these clinics are kind of acting as a specialist clinic. Their job is not to take over the primary care of that patient. We'd certainly rather that patient continues a therapeutic relationship with their regular medical practitioner. But it's good for these clinics and these primary caregivers to communicate back and forth so that they can stay on top of that monitoring and observation, any kind of interactions with the current medical regime, and then also how it may be assisting their current treatments.
Very much so. So I think the main reason is they've arisen out of necessity, in that the understanding from the general medical community around the endocannabinoid system, or how cannabis can potentially be utilized as a valuable therapeutic tool within their toolkit, is lacking, because there is little education out there. We weren't taught it through any of our university sort of training pathways. We weren't taught it through any of our specialty training pathways, and it's only through through a practitioner's own interests and self-directed learning that they've probably embarked on this journey. We are now hoping to get more formalized sort of training pathways, but knowledge and awareness is lacking from the general community, the general medical community. So it is a nuanced medicine. And even though any doctor can prescribe, like anything, no doctor should prescribe if they have no knowledge about the medicine which they're prescribing. And that knowledge is just lacking at this stage.
Now, you mentioned this briefly, but what are the current pathways that one can take to prescribe medicinal cannabis? You mentioned the SAS pathway and the AP pathway. So what are those?
Yeah, so the SAS pathway is the special access scheme. So the special access scheme has really been set up for unapproved medicines, so medicines that aren't on the PBS, to be accessed by clinicians for certain conditions. So it has been utilised for a whole host of other medicines or devices in the past, but it really has become a portal that is servicing the needs of most cannabis prescribers out there. So it's done on a patient by patient sort of basis, based on on a product by product basis as well, and it's an online application and process. Doctors who have done a certain amount of cannabis prescribing and have shown that they have the knowledge prerequisites to work more autonomously can be made an authorized prescriber for certain medical cannabis products for certain conditions. So this negates the need to do that application through the SAS pathway each time you want to access medical cannabis. So it makes it a lot faster, a lot more efficient for patients, but there are other checks and requirements that those APs need to go through as well.
Interesting. And then just roughly, how long does a TGA application take?
Look, that can be how long's a piece of string. It depends on the demand that's placed on the system, so or whether there's been any sort of upgrades or changes. But it's generally, it generally is done within a week. Sometimes it's 48 hours. I've had ones that have come back within 5 minutes, and sometimes it's 2 weeks. But generally, I would expect a SAS application to have been processed and finalised within a week.
That's all right. And then just going back to the nurse practitioners as well. So MDs, GPs, and specialists can prescribe in any state. Nurse practitioners, on the other hand, can prescribe in Northern Territory, Queensland, South Australia, Victoria, Western Australia, and the ACT, and cannot currently prescribe in New South Wales or Tasmania. In the jurisdictions that do allow nurse practitioner prescribing, there may be some specific requirements regarding their scope of practice, so it's recommended that NPs contact their local board of nursing and midwifery. Okay.
And look, on that as well, I think it is worth noting that the state-based requirements aren't based on the patient, they're based on the prescriber. So if a lot of the clinics are doing telehealth and seeing and accessing patients in other parts of the country, the requirements are actually based on where the prescriber is, not where the patient is.
Okay, interesting. Cool. Well, just to conclude this episode then, essentially anybody in Australia that is a registered medical doctor, general practitioner, specialist, or nurse practitioner can technically prescribe cannabis. There are no special courses or requirements or accreditations that you need to acquire before you do prescribe cannabis. The prescribing of cannabis can occur via the SAS-B pathway or via the authorized prescriber pathway once you become more confident and comfortable in using these medicines. There are some state-by-state variations in terms of the requirements for you prescribing these medicines. It really does help to check in with those individual state legislations. And then finally, if you would like to learn more about how you can yourself prescribe medicinal cannabis products, well then stay tuned, because this is a series on how to do so.